time is now. Welcome back to the Time is Now podcast. Thank God we could be here together today. On this podcast, we speak to entrepreneurs from all industries and figure out what makes them tick, where they came from, what business means to them, and how they achieve success. I'm Dr. Slava, a doctor of physical therapy, serial entrepreneur, and your host. Hi, everybody. And again, welcome to the Time is Now podcast with me, Dr. Slava. Today, we took this show on the road to one of my clinics. Behind me, you see the clinic, into the exercise space. Today, I want to answer some questions. People have been asking questions about pain. This week on my social media has been revolved all around pain because this has been a pain week. We just left that Thanksgiving. People ate some garbage stuff. People are inflamed. People are hurting. They cooked. They stood. They cleaned. They sat around. They played some football. The weekend warriors trained some muscles. So this week is a good week to talk about pain. Let's get into it right now. All right, here we go. We often reach for medication first to treat pain. When should people consider seeing a physical therapist as a first line of defense instead? Oh, that's a great question. Look, the bottom line is this. You could always take pain meds, right? Pain meds are available at the pharmacy, stores, at the gas station. You can always get pain meds. There's no shortage of pain meds. I think if you look in your cabinet, I'm sure you'll find all kinds of things to cure pain. Physical therapy is not just a feel better kind of profession. Physical therapy is designed to get you better. Why do you have pain? What is the source of pain? What can we do to make your pain not only better, not only feel better, and that's not what I go by, is the feel, but I want you to be functionally better. What can't you do? What functional limitations do you have? So physical therapy is always indicated to relieve some of your pain, discomfort, and most of all, to get you back doing the things that you love to do. What role do mechanics and movement compensation play in chronic pain development? When someone's in pain, how does the body start to move differently? Oh, all right. So, chronic pain is debilitating. Anybody who's had pain or pain for a period of time know that it really alters how you do things. It adjusts your mood. It adjusts how you do things. It's life-changing. So when you have chronic pain and you have a movement disorder, physical therapy helps restore whatever disorder has been created. For instance, when I've been sitting at the computer for many hours, day after day, hour after hour, month after month, and I'm in pain and I have this bad posture, okay, it's going to affect how I do things. It's going to affect how I care my kids. It's going to affect how I keep typing. It's going to affect household chores. It's going to affect whether I want to go shopping or not. It's going to affect all those things. So what we do is we help people regain posture, stretch, move, improve alignment, improve awareness, and start working on the things that caused the impairment itself, right? So we work on all impairments and functional limitations, get people going. When people have pain, it really affects every part of life. So all those things that you want to do and function are definitely affected, and we would definitely want to improve those things because you want to get back to life, back to work, back to play, back to health. Very catchy stuff. Number 3, when assessing a patient's pain, what tests help you distinguish between nerve, muscle, and joint pain sources? How do you track down the origin? That's a very good question. We often get asked that. Patients Google things. They come in with a whole host of things that they've read online, they've heard from their friends, maybe a doctor or a different type of practitioner. We use a lot of special tests, and we want to differentiate what tissue is involved. So a nerve does behave differently than a muscle. For instance, We have patients that sometimes come in with these chronic hamstring strains, an athlete, and they're constantly straining a muscle. They're constantly straining a muscle. All right, they could be out of shape. They could be just not flexible enough. They could just be weak in that certain muscle group. Or oftentimes what happens with these chronic strains, especially in athletes, is that they have a restriction in what's called neuromobility. And it's actually the neural tissue that has a hard time gliding and is restricted. It doesn't like it. The body's compensation is stop, contract. We don't want to do this. We don't want to injure the nerve. So it sends off signals and you keep pulling that hamstring, which is also a problem, but it also doesn't want to sacrifice the nerve for being overstretched and possibly more traction to the nerve and having nerve damage. Nerve pain is specific. It's like, wow, I feel it right here. It's shooting from here to here. It's got a tingle. It's sharp. It's like it's electric. Muscle pain is achy. It could be sharp at times, depending where it is, like shoulder tendonitis, elbows, knees. Sometimes it can be sharp in a specific place, like in a spot. Okay. That's not usually indicative of nerve pain. So something specific right there at the joint usually is muscular tenderness, things that travel and have these sharp, stabbing, electric type symptoms are sometimes nerve. And don't forget, fascia also is innervated tissue and sometimes presents with symptoms kind of like nerve pain, and it's more fascial pain, but that's a whole nother story in itself. We'll travel that road when we get there. If anybody has specific questions about fascia and its intricacies, we'll talk about that at some future time. I have information on previous educational posts about fascia, and it's good stuff. So it's really important to sometimes know the difference between joint, muscle, and nerve pain. Inflammation is a driver underlying much chronic pain. What manual therapy techniques or modalities do you use to efficiently reduce inflammation and swelling? Oftentimes, we use exercise as a great modality. It's a great tool. Exercise is one of the best heating modalities. Exercise increases tissue temperature, extensibility, promotes circulation. So exercise is a good warming technique. We use hot packs sometimes, although hot packs penetrate, according to literature, maybe 1 centimeter, which is not much under the tissue. Let's say if it's a knee or an elbow, sure, you're going to get some benefit. If you have a big old glute and you squat 500 pounds and, that's not going to do much for you, right? So we use things like ultrasound, which penetrates pretty deep. We use electrostimulation, which helps improve circulation and modulates pain. And we use a lot of manual hands-on techniques. I'm also a lymphatic specialist, so I decongest the body and move fluid where I need to decongest certain areas, improve lymphatic flow, improve the immune system. So we do things like that. Manual therapy is great of moving fluid. It's great at improving extensibility of tissue and getting things really warmed up, ready for work or decrease inflammation. For persistent low back pain sufferers, describe a simple at-home mobility sequence or exercise routine they can follow between PT visits to help relieve and prevent pain episodes. I've done a lot of videos on different techniques and different movement patterns to help neck pain, low back pain. There's a lot of different sequences that we do. Right now, in the scope of this podcast, it's going to be hard for me to get down and show people, different exercises, but go into the Dr. Slava on Instagram or Facebook or YouTube. We have plenty of things and plenty of videos that we've done in the past about how to improve the low back and some of the exercises for neck, back, knees, hips, and pretty much every body part. Many patients fear movement will aggravate issues like arthritis, sciatica, or shoulder impingement. How do you build confidence in using the body without increasing pain levels? That's a great question. One of the biggest misconceptions that people have when they visit me, and I make a joke about this all the time. What does PT stand for? Pain and torture. Not just physical therapy. So people come in, and sometimes they've never been to physical therapy, and they think it's going to be light and fluffy. They're going to come in, and we're just going to treat them like a spa. They're going to get a manicure, pedicure, maybe a light, fluffy massage, but that's not the case. So we tell people, unfortunately, to help you, we're going to have to cause some discomfort. I don't like to use the four-letter word pain, that we cause pain, but it is uncomfortable. Stretching is not fun. Stretching is uncomfortable. Strength training is uncomfortable. Doing different stability movements is uncomfortable. And guess what? Sometimes, we're going to cause some discomfort. And even though that you have things like sciatica, shoulder impingement, and you believe that it's the worst in history and no one's ever seen that before, and it's like, wow, you've never seen an impingement like this. You've never seen a sciatica like this. Most likely I have. So I've been treating patients for 20 plus years. I've seen quite a bit. I've had patients come in on a gurney from an ambulance, and we help them walk out the door. So listen, you're going to have things, and you're here for pain. And unfortunately, to help your pain, I'm going to have to cause some discomfort, some painful movements, and it's not going to be all pain-free. However, the science, everything that we do will showcase, how we make people better. So although you're going to have to trust the process a little bit, and you're going to wonder how on earth that causing discomfort is going to help your pain, but over and over and over again, we treat thousands of patients every single year, and we don't make 100% people better. For whatever reason, the main doctor upstairs controls how you get better. However, we have piles of literature and piles of anecdotal evidence to show that what we do does help people get better. Question number 7. What self-care tips do you give patients recovering from knee, hip, or spine surgery regarding managing discomfort and inflammation while still healing properly? So, depending on the surgery, it varies, especially depending upon the specific tissue that's involved. Some surgeries actually will require a little more time to heal before you start physical therapy, because that tissue needs to not be stressed in order to heal properly. Some tissues need immediate response and have immediate need to start moving. So depending on the surgery, that'll dictate what we do and how we do. Most surgeries, orthopedic-wise, patients will be in it pretty quickly. If they don't have any major comorbidities that sent them to a SNF, a skilled nurse facility, or home health, patients are in here pretty quickly. And we do things that help them have mobility or start initial contraction, get the brain body connected. Sometimes, they just got out of a boot or just got out of a cast after surgery, and they need immediate motion. But maybe one motion is restricted and not allowed to move based upon the physician's prescriptions, or sometimes everything needs to move, and we need to get this person weight bearing as quick as possible, get them off crutches, and get them mobile as soon as possible. So, the things that they need to do at home, basically, is to protect that area. Everything that your doctor of physical therapy prescribes most likely will be for your benefit, not only for the short term, but for long term. So the self-care will be depending upon what happened and what tissues involved and what exactly was the surgery, how long you were out, what are your precautions, what are your contraindications. There's a lot of factors. So the diagnosis will dictate the direction we take. Pain retraining the nervous system seems to be an emerging method for some modalities. Can you explain that approach and process to our audience? Okay. So retraining the nervous system is what we do. There are conditions where the pain message to the nerve is so amplified that it could be a medical emergency. Did you know that some patients, because of pain, will increase their heart rate so high to potential dangerous levels? And those people need to be monitored because, a lot of things can kick it off. Your clothes, the wind, somebody accidentally brush up against you. All those things and some nerve conditions are so heightened, they're so exaggerated that they could be literally a medical emergency. Most people fall into the category lower than that. Yes, it hurts, and these pain signals are real. One of the modifications that we use is start to introduce lighter sensations. So avoiding everything is not a good method. It's not good methodology to help heal. The nerve will never have the recovery by itself to reestablish networks and normalcy of what that nerve does. Remember, you have a lot of receptors underneath the skin. You have different receptors for pain, deep touch, light touch, vibration, pain temperature. There's a lot of things, a lot of tracks that go through the spinal cord and brain. So the modification we use is to start introducing all those sensations, light touch, deep touch, and the brain eventually and the nerve has to distinguish what exactly you're doing to it. So that causes adaptation, and it's called neuroplasticity. When the nerve adapts to what you place it under, there's remodeling, there's training, there's learning, right? So you are training the nerve to behave the way it should in the first place, while avoiding injury, while avoiding prolonged aggravation. So we do things that are called desensitization, neuromodification, all these concepts in neuroplasticity, meaning recovery of the nerve to make it adapt to be, functioning the way it should be. What future advancements of technology innovations on the horizon are you most excited about for treating pain without medication or surgery? There's so many things coming out on the market, and we always talk about technology as a thing, maybe like a robot or a machine that does lights and does stimulation and things like that. But one of the technologies I'm really, really excited about is some of the biological injectables. There's pain management doctors that are doing some amazing research on immunoglobulins, stem cells. There's different gels and cements and things that help the body recover or create lubrication, create space in the joint, create space between vertebrae. There's a lot of things on the horizon that are coming out that are getting better and better. Look, there's claims in different countries that some of these injectables are now regrowing cartilage and decreasing pain and improving, circulation, doing all these modifications and improving the immune system. I think it's great. Unfortunately, if it was so great and we were there already, it'd be a gold standard and everybody would be in line to get them. I know people are going to argue with me. It could be controversial. Excuse me. But we're not quite there. And for whatever reason, some of these things work well in a test tube. They work well in a lab. And I've had quite a few patients over the years that have had injectables in different countries and here from most renowned doctors. And some of them will be like, wow, this is great. And some of them are like, didn't do much. So We want to get to the point where I can inject stem cells into a knee and the cartilage regrows. And it's pretty much 100% successful because it's valid, it does what it says it's going to do. Right now, we have a percentage of people that helps, and we have a percentage of people that doesn't. So I'm excited to work on things that are so bioidentical to how the body works that it pretty much works in 100% of the population. That'd be great. I'm looking forward to the advancements. I think they're wonderful. And if there's any tool out there, like electrostimulation, UV light, red light, that improves circulation, I think these are all great. I think they're all wonderful. And I think we have a great future. And besides that, we do a lot of good hands-on stuff, exercise training, posture retraining. We help people with a lot of advice. We help people hands-on. We help people get better for the future. We are the myofascial neuromuscular experts. We're here to help. Ask any question. Come see us. We're here to help you. Thank you very much. It's been a pleasure as usual. Thank you. Thank you. Thank you. Be sure to like and subscribe if you're watching us on YouTube. If you're listening, make sure to rate us on Apple Podcasts and Spotify. Thank you for listening to The Time Is Now with me, Dr. Slava Shut. Remember to tune in every Friday at 2 p.m. and send in your questions to Dr. Slava Shut on Twitter. Thank you. Thank you. Thank you.